Hello, this is Dr. Dennis Hartlieb with Cosmonauts Tip of the Month. Today's tip is the direct resin bonded bridge. Today we're going to be working with Emily, and if you look at Emily, you'll note that she's missing tooth number 7. It's a congenitally missing tooth. Also note that tooth number 10 has some pre-existing bonding. This is a peg lateral that was bonded. And Emily's been referred to me, unfortunately, as you'll see from the radiographs provided here, there's significant root resorption on all 6 of these anterior teeth, and there's relatively significant mobility of all 6 teeth. So beyond just doing the resin bonded bridge, we're going to be splinting these 6 anterior teeth. Regarding the splinting technique, I have another tip of the month that shows how to do periodontal splinting using Ribond and the Renamel composite materials. So we'll be going through that a little bit quicker so that we can get into how to actually make the Ribond bridge here in just a few minutes. But you can look forward to that on another tip of the month. Looking at the occlusal view from Emily, you can see the missing tooth for the tooth number 7. But also note that there's hyperplastic tissue around the cingulum areas, around the linguals, the palatal areas of those anteriors, especially related to tooth number 10 and number 11, from the flipper that Emily wears. So we're going to have to deal with that also during the time of treatment. So for the procedure, and you'll note that I've created a groove that runs through the middle of the tooth. The groove is about 2 to 3 millimeters wide and about 1 millimeter deep. It goes from the one canine all the way to the other canine. Also note that I've had to do some electrosurgery around the soft tissue, around the palatal aspect of teeth number 10 and 11, so I can get more clinical crown length to make sure that that tissue wasn't going to interfere with the periodontal splinting. Now, as I talked about in the periodontal splinting technique that I'll show on a separate tip of the month, essentially I'm going to etch all these groove areas. I'll put on my adhesive, and I have a Ribond cord that's pre-cut that's going to go from one canine to the other canine and sit inside all of those grooves. The Ribond has been saturated with Cosmonauts unfilled resin from their Cosmonaut Complete system. And then I use D-Mark, the flowable composite, in the distalmost contact area. So in this case, I'm going to start with tooth number 6. I'll place some D-Mark into that lingual groove, and then I'll start my Ribond into that area. With the Ribond material running through number 6, where the D-Mark has been cured, to maintain it in that position, and then into tooth number 8, and then to number 9, number 10, and number 11, using the D-Mark first to sort of tack the Ribond into that lingual groove. Now critically, you'll note from the occlusal view how the Ribond has sort of the C shape. I want to make sure that I blend that Ribond in towards the facial. If I just leave it to the lingual, I'm not going to have enough support of the Ribond into this ponic area. Now, after I have the Ribond cured with the D-Mark into each of those teeth, then I'm going to use Cosmonauts Nano Composite out of the centric syringe. This is their A2 Nano, and I will literally go in and seal all those lingual grooves, making sure that I'm covering all of the Ribond material, because we don't want to have any of that exposed, because that will start to fray if there's any occlusal forces on any of that Ribond. So that's all completely cured. And then we'll look from a facial view, and you'll see the Ribond as it expands between tooth number 6 and number 8. Now, in order for us to create a ponic that has a nice smooth ovate surface along the lingual, I actually take a sectional matrix band from Garrison Dental, and I'm going to take my D-Mark material, I'm going to flow my D-Mark material into the matrix band just on the countertop. And what's great about this D-Mark composite, this flowable composite from Cosmonaut, it doesn't overflow. It flows enough, but then it has some stability to it. So when we look at the next image, you'll see that there's almost this ovate form that's created by just allowing the D-Mark to flow into a natural contour, and then it's light cured while it's sitting on the matrix band, as I show here. It's removed from the matrix band, and I'm ready then to bring it to the mouth. Now in this image, you'll see that I'm holding this ovate form onto the soft tissue and applying pressure. This is done with the multi-purpose instrument by Cosmonaut. And I measure to make sure that the ovate form is appropriate for the buccal lingual width of the teeth, and I'll trim it if necessary if it's too wide. But I want to get the appropriate form buccal lingually and mesial distally. So I'll trim it as necessary, and then I'm going to put it back along that edentulous space, and then with pressure, I use this multi-purpose instrument to apply pressure to the soft tissue. And you'll notice there's a little blanching in the tissue. I'm going to take my D-mark composite and I'm going to flow it onto the ribond and then flow it onto that little ovate pontic form that I created. And then while holding it with pressure, then my assistant will light cure that D-mark that then will maintain my little ovate form supporting the soft tissue. So that's light cured. Now I have a very smooth subsurface, so it's easy for flossing and for hygiene purposes. And now essentially I just have to add composite to that D-mark form, that pontic area, onto the ribond to create my natural tooth form. So I'm going to start on the lingual first, and I'm going to go back to my centric syringe, and I'm going to inject my A2 composite, my A2 nano, into the lingual. And I'm going to just compress that into that ribond and then down onto that pontic form. I'll use my multi-purpose instrument to start creating the appropriate lingual palatal anatomy. And then once I'm satisfied with the contour, then I'll light cure that for 10 seconds to hold that form. Then when we look from the facial aspect, you'll see the pontic shape, you'll see the A2 composite creating the incisal lingual form. And now I have to repeat this from the facial perspective. So I'm going to come back with my nano A2 composite. I'm going to inject that so it fills any of the voids between the pontic area and the nano composite and ribond that I've built from the lingual. And using pressure, I'm going to inject that material, then go back with my multi-purpose instrument to blend it into that ribond, nano, and that D-mark pontic ovate form that I had created. I'll use my IPC instrument to make sure that there's no excess interproximally and then make sure that all the composite is blended in smoothly. Once I'm satisfied with this initial contour, I'm checking from the incisal to make sure that I'm not overbuilt, and then I will light cure that for 10 seconds. Now critically, when you're creating these pontics out of composite, it's important to use a layer of opaquer to block out some of the light transmission that's going to occur. You may not feel like you're going to need it, but my experience is if you just use the composite without using opaquer, the tooth is going to look too low in value. So I will always use an opaquer of the same shade of the nano composite to help block out some of that light so the value of the restoration doesn't end up too low. So this is the A2 opaquer from Creative Colors, using the number 1 artist brush from Cosmodent and blending that on over the facial surface of that nano and down onto that ovate pontic area that I created from the D-mark. That opaquer is light cured for 10 seconds, and you can start to see how it's starting to block out some of that light transmission. I want to add some coloration to the pontic so that it blends in with the natural teeth. So there's quite a bit of hypocalcification in the natural teeth, so I'm going to use some of the white opaquer. I use it as a tint to add color. So you'll see I'm going to be adding towards the incisal, and I actually add a nice band through the middle center of the tooth. To add translucency effect to this tooth, I'm going to use the microfill incisal light translucent composite. We're going to use this in the incisal third of the tooth. You can see I rolled into a convenience form, and I'm just going to be blending that into the nano composite that has the opaquer and the white tint. And I'm going to use this incisal composite and blend that into the composite surface. I'll cure that for 10 seconds, and that's what the incisal composite looks like. Now I want to add more chroma to the gingival aspect, so I'm going to use some A2 composite, the microfill here, to build out my final contour in the gingival third, and to give me the final polish of the microfill, and give me a little bit more chroma here at the gingival third. So I'll use that A2 microfill for the gingival. And then over the entire surface then, I'm going to be using a brighter composite. This is an A1 microfill that gets blended over the entire surface using a series of instruments, including my IPC instrument and the multi-purpose instrument. Once I'm satisfied with the final contour, I evaluate it from the facial and from the incisal, and then I'll do a final light cure. Now my final light cure is going to be 60 seconds per surface because I want to be able to maximize the strength and the polishability of my composites. So both on the palatal and on the facial I'm going to cure for 60 seconds. Once the composite is finally cured, I'm going to be using a fine diamond burr by Brasseler to start doing my initial contouring. I like using a diamond burr for teeth like this where I want to start adding some surface texture like we see in the adjacent teeth. I'll be using the flexi disc system from Cosmodent to adjust the length of the tooth, and then I use these small diamond discs from Brasseler to help open up the embrasures, the facial embrasure and the incisal embrasures. I'm back to my flexi disc system. This is the medium size of the blue disc. The blue disc, you'll notice there's a lot of flex on the disc. I want to create as much flex on the disc as I can. That will give me the best surface polish of the composite. Now on the microfill, when I have teeth that I'm trying to create sort of a soft satiny appearance to blend with the other teeth, I like to use Cosmodent's Flexi brush. It's an aluminum oxide brush that I find I can get a really nice sort of satiny surface to the microfill composite. And then for the cervical aspect, I come back and I use my Flexi cup from Cosmodent. This is the blue Flexi cup. And then I use the pink, which gives me the superfine or the super polish for that gingival. And then I'm going to come on with my enamelize, and I use my Flexi buff disc to give a final hone polish that you note in the facial appearance. And overall, I think a nice blending of this ponic with the natural teeth and giving the patient an option not to have a removable appliance, and also taking advantage of splinting the anterior teeth due to the extremely short roots that she has. Well, I hope you enjoyed today's presentation, Cosmodent's Tip of the Month. I hope that you find a way to be able to use this in your clinical practice. I know in my practice we see a